before we do our final segment, we'd like to share some footage from Elder Fair 2016 with you, which was shot by our community partners at Somerville Community Access Television. We were thrilled to have them as part of the event, and we are really looking forward to sharing some of the great footage they took there. So check it out.
Hi, I'm Marianne Dalton, and we're here today at Elder Fair, which is sponsored by Somerville-Cambridge Elder Service. It's an annual event, and we have over 50 vendors here today, and they're here to provide information to older people, their caregivers, family members, some younger folks living with disabilities. These vendors provide like a whole range of services that help older people remain independent in their own homes. We have transportation vendors, medical providers, assisted living providers. We have folks who are here from Social Security to help people discover some of their options in terms of, you know, retirement income, their Medicare benefits, and that's what Somerville-Cambridge Elder Services is all about. We want to provide people with as many options and choices for independent living, because it really is possible if you plan to, you know, live a healthy, long life in the community, surrounded by your friends and family and things you love to do, and that's what we do. We're a gateway. Somerville-Cambridge Elder Services is really the gateway for information about services for older people and caregivers and some younger people living with disabilities. We can tell you people about all the programs that are available to them, from home care to transportation to Meals on Wheels. There's so much out there now, and I think that the first thing that people need to do is just call and to ask about the resources. There's so much that you can take advantage of today to really live well in the community.
So my name is Rose, and I work with Samaritans, and we are a suicide prevention organization. We're located right by Downtown Crossing, and what most people know us for is we have this 24-hour hotline that people can call or text any time of the day for whatever reason. So we know that, especially for seniors, a lot of them feel like they don't have a support network, someone that they can talk to, and the loneliness, the isolation, it's a very serious thing for seniors, and the suicide rate is actually very high. Middle-aged white men have the highest suicide rate, and then for elders, it's a really serious problem. So we try to be there in their time of need, just to listen, support them, and just to be a non-judgmental person who will be there 24 hours a day. And that's sort of what we try to do to support elders, but we also do community outreach and education, trying to educate elders and people that work with elders about what are the signs of suicide, what are risk factors, warning signs, and how do you cope with your stress, how do you cope with the isolation and the loneliness that you're feeling.
And I'm with Natali Company and Safety Care. So we specialize in grab bar installations, but any equipment that helps the elderly and disabled, we are specialized in that. Wheelchair ramps, stair lifts, chair lifts, the whole 9 yards.
I'm Kathy Hoey, and
I'm Lillian.
And we're from the Cambridge Health Alliance. We do geriatric psychiatry. We are doing mental health services to people who are referred to us from their primary care doctors from the Cambridge Health Alliance. We also have a clinic at 26 Central Street. We see clients there, but we also do home visiting in the Cambridge and Somerville area, in the Elder Building, Somerville Home, a number of places that we see folks.
So I'm really passionate about the work we do at Somerville-Cambridge Elder Services, because it really is all about providing people with options. I think for too long, people felt like as they aged, they only had one option, and that was to go into a nursing home. And we're finding more and more that people are able to live at home, to stay at home, even when they have a lot of physical limitations. There are programs that can help people stay in the place that they want to do and make the choices that they want to make every day. And I think that's why I feel passionate about elder services, is that we're advocates for helping people have that desire fulfilled. And there's no reason why people should feel that institutionalization is an inevitability for them. And the first step is for families to seek out this information on behalf of their loved ones, or for individuals who want to know what their options are, is just to call us and to talk to our staff. They are really passionate about helping older people find the kind of living situation that they truly want to be in.
Hi, my name is Rod Pava. I'm with United Healthcare. Just want to say thank you for having us. Our plan is the Senior Care Options Plan. We have a contract with the state of Massachusetts as well as the federal government, Mass Health and Medicare, to provide additional benefits to seniors over the age of 65 with Mass Health Standard. It's a no-cost program. We provide additional coverage such as complete prescription coverage, glasses, hearing aids, transportation, as well as full dental. So we thank you very much. We love the opportunity to spread awareness, and hopefully we've given out some good information to folks in the community.
I'm here with Mr. Lloyd Mann, and like myself, he's the first timer at this event. So tell me, what brought you out today?
Well, the rain brought me out, but it brings out a lot of other people for a lot of good information. And all these tables have a lot of wonderful pastime and talking to people and getting acquainted with healthcare, and it's just a wonderful program to keep going and coming to every year. And I have a great time. I meet a lot of new different people, nurses, and different programs that I can get acquainted with to visit and see what they're like.
Elder Service Plan.
Okay.
We serve people that are 55 plus and who might have need for showers or bathing, need more assist. And we can take them, we have a whole team that walks them right through the entire healthcare spectrum, share the care with the people. We call them participants because we want them to participate in their own healthcare, as well as any caregivers they may have on board. We can provide assisted living and even nursing home care.
Years and years ago, I got an AARP thing in the mail that said they needed money managers. So I signed up, and I have been helping a blind lady for 7 years. Pay her bills and open her mail, etc. I think there will be more and more need for services available to aging citizens. They need to call Somerville-Cambridge Elder Services, 61 Medford Street in Somerville.
We have over 300 volunteers, and there are so many ways to get involved with Somerville-Cambridge Elder Services. You can go to our website, www.eldercare.org, or give us a call at 617-628-2601 and talk to our staff, and they can explain the many ways that you can help your community and the older people in your community.